Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. You know, a very hot topic these days is Kybella. Kybella has gotten a lot of news play recently, and it was FDA approved in the spring of this year after thousands of patients from studies. And basically, Kybella are a series of injections that are performed for people that have double chins. And basically how it works is something called deoxycholic acid that is a naturally occurring molecule in your body, and that is injected in a very controlled fashion to areas of the double chin at particular sessions, and these sessions usually are about a month apart, and studies have shown that most patients need about 4 treatment sessions. So what does it do? Basically, it dissolves the fat. Your body will reabsorb those products of that fat dissolution, and over time that swelling will go down and you will see some secondary skin contraction. I think it's very important from a safety and quality assurance part that I think it's important to be screened for this procedure before, and for me to honestly assess whether you're a good candidate. You know, people are coming in and I feel as though I'm disappointing them, but I'm just trying to do the right thing for them. And somebody who has nice skin tone and a localized double chin, they're wonderful candidates for Kybella. And again, that's a series of injections. It only takes about 20 minutes in the office, and then we're seen again in another month, and then we do the same thing up to about 4 to 6 treatments. In patients that have excess skin or diffuse fat in their neck, not such a good idea for you. That patient probably needs some liposuction or something like a neck lift. In somebody who has very significant turkey gobbler bands in their neck, if they have good skin tone, that could be treated with some Botox injections along with some other non-invasive skin tightening or liposuction in order to get the results that you're looking for, not Kybella. In somebody who has a lot of excess skin, I don't think Kybella is the greatest thing for them or you. The reason being is that you'll end up with excess skin and not like the results. So probably a surgical procedure is going to give you the best aesthetic result. It's so important to remember in patients that have had neck surgery, whether it be like a thyroid or parathyroid, or have had previous procedures such as liposuction, not a candidate for Kybella. Reason being is that it's not predictable in terms of injecting something that will dissolve fat when there's a lot of scar tissue there. So the best way to understand Kybella is it is a chemical that's injected to dissolve the fat. Right now it's only FDA approved for double chin regions. It's performed in people that have the localized fat there with moderate skin tone, and I think that overall it's a wonderful addition to a non-invasive armamentarium for a plastic surgical practice. Not everybody's a candidate for it, and that's why you need to go to somebody very honest to give you an assessment, to make sure that you are a great candidate, to make sure that you're not going to be wasting your time and money, and to make sure that you're not going to be disappointed afterwards with the results. So best way to figure out if you're a candidate for Kybella, come in for a consultation. I'll talk to you, we'll examine you, and we go from there. Thank you very much.